year, millions of women hear the same word. A word that freezes you: cancer. Breast cancer is the second leading cause of cancer death among women worldwide. But what if I told you that the cure is largely in your hands? Today, in Pink October, we're going far beyond the ribbon and the color. You will fully understand the history of a movement that saves lives, the science behind the disease, and most importantly, the essential step-by-step guide to prevention. We'll dive into the origin of Pink October, debunk the myths of self-examination, and understand the importance of mammography. If you are a woman, if you have women in your life, or if you are a man, this content is indispensable. Stay until the end, because the last part is where we show you how to turn awareness into real action. The story isn't about a day, it's about a promise. In 1980, in the US, Nancy Brinker lost her sister, Susan G. Komen, to breast cancer. Susan made her promise: "You have to end this disease." 4 years later, the Susan G. Komen for the Cure Foundation was born. The most famous symbol, the pink ribbon, emerged in 1990 at the first Race for the Cure. The idea was simple: to give a visual identity and a sense of community to the fight. Pink October, as a campaign month, gained momentum in the mid-90s with the lighting of buildings. It was a way to make the message jump out at society. This global visual campaign, making the movement visible from New York to London to Sydney, cemented October as the month dedicated to breast cancer awareness. Understanding the history is understanding that this fight is about unity. It's not just about one month, but about a legacy of women who refuse to accept silence.
And in 1980, and asked me if I would do everything I could in my life to cure the disease. So we created the Susan G. Komen Foundation, and she also asked me to promise that I would do something to take care of those who could not take care of themselves, who were under-resourced, and made sure that we got them treatment and screening.
Simply put, breast cancer is the uncontrolled multiplication of abnormal cells in the breast, forming a tumor. While often seen as a women's issue, it's vital to know that men can also get it. Though it accounts for only about 1% of all breast cancer cases, the disease in men is often diagnosed at a later stage, making awareness crucial for everyone. The great challenge is that the breast is a complex organ. We have several types of breast cancer. Therefore, there is no single treatment. The key is personalization and, of course, early detection. Let's debunk some dangerous myths. Myth: does antiperspirant deodorant cause cancer? Fact: there is no scientific evidence to support this. Myth: is breast cancer always hereditary? Fact: only 5 to 10% of cases are purely genetic. Most are sporadic. Myth: does hitting or squeezing the breast cause cancer? Fact: no. Trauma is not linked to the development of the disease. Although most cases are not hereditary, we need to talk about those with increased risk. A strong family history, early menarche, late menopause, and the use of hormone replacement therapy. About 30% of cases can be prevented with a healthy lifestyle. This is a game-changing fact. Focus on weight, maintaining an ideal body weight, alcohol, limiting or avoiding alcohol consumption, physical activity, practicing at least 150 minutes of moderate activity per week. Breastfeeding. Breastfeeding is a protective factor. Your health today is your protection tomorrow. The care starts with your routine. Self-examination does not replace mammography, but it is vital for self-awareness. You need to know what is normal for your body. Practice it regularly. The best time is after your period. If you notice anything different, see a doctor. The clinical breast exam, CBE, performed by a professional is essential. And mammography? It is the most effective tool to detect cancer before it is even palpable. Women aged 50 to 74 should follow screening guidelines. If you have an increased risk, talk to your doctor about starting earlier. The rule is, talk to your doctor. Don't wait for a lump to appear. These are the signs that require an immediate medical consultation. Lump. A mass, usually hardened, fixed, and painless. Skin. Orange peel appearance, swelling or dimpling. Nipply. Inversion, redness, sores, or spontaneous discharge, especially blood. Axilla, saw, neck. Lumps in the armpit or neck area. Remember, these warning signs apply to both men and women. Most lumps are benign. But you will only know for sure by seeking professional help. Don't self-medicate. Don't wait. Breast cancer today has one of the best prognoses, especially when caught early. Treatment is based on surgery, chemotherapy, radiation therapy, and hormone therapy. Advances in medicine have made treatments less invasive and more effective. Hope is real. Cancer is not an individual battle. We need friends, family, and especially psychologists. Treatment affects the body and the soul. If you are going through this, look for support groups. Emotional and psychological support is just as important as medical treatment. You are not alone. We've covered the history, the science, and the actions. Pink October isn't just a one-month campaign. It's an annual reminder to put our health first. This message is for everyone. The prevention is your greatest power. If this video taught you something, I ask you for just 3 practical actions today. Schedule your clinical exam or mammography, if applicable. Start practicing regular body awareness. Share this video with 3 important people in your life. The information you just received could save a life. Be the one who makes a difference. Wear the pink, but above all, use the information. Until next time, and take care of yourself.